Woo!
Hello, everyone.
Hello.
How's everyone doing?
Well.
Fantastic. All right. So we're SwipeSense, Hand Hygiene 2.0. My name is Yuri Molina. I study mathematics and physics at Northwestern University.
And my name is Mert and Yuri, and I've studied product design and entrepreneurship also at Northwestern University.
So as I said, we're Hand Hygiene 2.0. But you might be wondering, what's wrong with Hand Hygiene 1.0? Well, every single year, over 2 million people get an infection after they're admitted to a hospital. Of those 2 million people, 100,000 of them will die from that infection. That's entirely preventable, and that's more than breast cancer, car accidents, and AIDS combined every single year. Now, in addition to this huge cost of life, there's also an economic burden as well. According to a study done at Duke University Medical Center, a single MRSA-related infection can cost the hospital up to $47,000. If you take this and spread it across the industry, we're looking at an annual cost of $5.7 billion, and that is the lowest estimate out there. According to the CDC, the WHO, and numerous other organizations, there's a solution out there for this problem. And that solution is hand washing. And currently, there are two ways of washing your hands in a hospital. The first is the soap and sink that we all know has been around for centuries. And just in the last decades, we've seen these pop up. The wall-mounted alcohol gel dispenser. And these are actually recommended over soap and sink in most cases. But with these two hand sanitation methods, the average hospital in the United States has a staggering 40% compliance rate with guidelines. That means that our staffs are washing their hands less than half the time they're supposed to. But this issue is systemic. It exists across the industry in every single hospital. That means it's not something wrong with our physicians or our nurses. It is something wrong with hand hygiene itself. Currently, our staffs don't just need to wash their hands when they go in and out of a patient's bedroom like you might think. It's over 4 or 5 times per patient visit. Whenever you go from a dirty surface to a clean procedure, from the computer to the bedside, you need to wash your hands at each of these points. That's 60 to 80 times a day for an average nurse. It's simply unrealistic to expect them to meet these numbers with the existing hand hygiene systems. And the other problem with hand hygiene that we see lies within how that 40% compliance number is collected. Currently, in 2012, and the dedelibación that Neil talked about, is collected with pen and paper. Nurses are taken out of patient care, given a chart, and asked to check boxes and observe their peers. At best, this gets hospitals an end-of-month report, but more often than not, it's an end-of-year annual hand hygiene compliance report. This isn't actionable, and it's certainly not effective at increasing hand hygiene rates. So these are the two problems with hand hygiene today. There's no access to hand sanitation at the point of care, whenever the staff need it, and there's no real-time feedback to improve performance, and that's hand hygiene 1.0. It gets us 40% compliance rate and over 100,000 preventable deaths every single year. Now I'm going to hand it off to Mert, who's going to tell you how SwipeSense is tackling both of these challenges.
Thank you, Yuri. SwipeSense is Hand Hygiene 2.0. It is a portable dispenser that allows hand hygiene at the point of care, along with real-time data feedback to drive behavior change. We make money by selling our cartridges and a yearly subscription to access our data. So first, let's talk about accessibility. SwipeSense is always at the point of care, and it's extremely easy to use. The inspiration for our design came from this insight. Imagine you're 5 years old and you just got dirt on your hands. What would be the first thing you do to get the dirt off your hands? You would wipe your hands on your pants. As a matter of fact, we've spent 6 weeks at a hospital while we were designing this device. And we've seen healthcare workers do this over and over and over again. And they're told not to do this because it spreads infection. But it's impossible to unlearn. It's built into us. So we took that motion and we built it into the heart of our system. Each swipe gets you the same amount that the wall-mounted dispenser will get you. And each cartridge holds enough gel that an average nurse will last an entire shift. It is with this device that we're tackling the first problem in hand hygiene. We make it available at the point of care. But as Yuri pointed out, access and convenience is only one half of the problem. if you really want to improve hand hygiene, you have to provide meaningful data. And that's where the swipe hubs come in. These little devices plug into the wall of each patient's bedroom. They detect the room entry of the healthcare worker, and they transmit the usage data from the SwipeSense to our web application. We get frequency of use and location data. So an average nurse would, at the end of the day, would look at our web application and see, today I visited these 10 rooms, and while I was in them, I swiped my hands 1.5 times. Unit managers can take this data and actively set goals to drive the hand hygiene rates up. So for instance, I would start off with something super easy, like 1 swipe per room entry, which is very easy to do. And as soon as everybody reaches it, I set a new goal, 2 swipes per room entry, and then 3, and then 4. And slowly but surely, we can drive the hand hygiene rates up. Currently, our technology takes the data from the SwipeSense, pushes it to our web application, and visualizes it. There are many other ways that we can use this data to drive behavior change. And we're going to be testing all of them in our upcoming pilots. But here's the bigger idea. Instead of a monthly report that nobody looks at, we want to make hand hygiene visible, meaningful, and actionable. And that's Hand Hygiene 2.0. We make hand hygiene extremely convenient, always available at the point of care, and we provide meaningful data that drives behavior change.
So obviously, if you can't tell, Mert and I are very excited about it. But what do our customers think? One of them, his name is Mark Oliver Wright. He's the Director of Infection Control at North Shore University Health System. This is a 900 hospital bed network right here in Chicago. He had some words he wanted to share with you all today, so I'm going to let him take it away.
I'm Mark Oliver Wright, Director of Infection Control for North Shore University Health System here in Evanston, Illinois. The most effective way to prevent healthcare-associated infections is by improving hand hygiene compliance among healthcare workers. SwipeSense, by bringing the product to the healthcare worker, makes it easier for healthcare workers to be compliant with their hand hygiene practices. By being able to monitor the performance in real time, you can provide immediate feedback not only to the employee, but to their supervisors as well. The technology behind SwipeSense has the potential for reducing healthcare-associated infections, improving patient outcomes, and overall reducing costs of care. I'm looking forward to trialing this product and seeing the effectiveness of SwipeSense in the healthcare delivery system of today.
Thanks, Mark Oliver. So that's North Shore University Health System, who's committed to trialing SwipeSense in their hospital. But they aren't the only ones. Today we're announcing we've collected over 5 beta customers who've all committed to trialing SwipeSense. We have Swedish Covenant Hospital, Rush Medical Center, Mount Sinai Hospital, and Northwestern Memorial, who've all committed to this. Now our first pilot, which begins at So our first pilot at Northwestern Memorial begins this May. Now, we worked extensively with their director of their nursing department and their nursing staff, who will be collecting compliance data throughout this trial period. At the end of this trial, we'll be publishing the results of this pilot. This will be crucial, and the results of this pilot laying out the effect of SwipeSense on hand hygiene compliance. This will be crucial in establishing both the efficacy and the credibility of SwipeSense in the healthcare space. Now, Mert and I just want to highlight the enormous interest we've gathered just in our past couple months at Healthbox. The interest we've gathered from our 5 beta customers span the range from academic medical centers to community hospitals to urban trauma centers, who all see the potential of SwipeSense to prevent these infections. They see it applicable in all of their settings. But Mert and I are fully aware that no matter how effective SwipeSense is at preventing infections, it will never scale unless it makes economic sense as well. So now I'm going to walk you through our cost structure so you can get a better idea of our business model. For an average 200-bed hospital today in the United States, as we discussed earlier, they have about a 40% compliance rate. With this, they have over 300 or so preventable infections and up to $1 million in preventable costs. And again, this is the lowest estimate. These costs are primarily due to increased readmissions, longer lengths of stays, and non-reimbursed care from Medicare and other insurers. Now, the same hospital choosing to use SwipeSense, we'd expect to bump their compliance from 40 to 60%, and this is based on other hand hygiene initiatives in the literature, but we think we can blow this out of the water, reaching 70, even 80% compliance rates. Now with this, our system would cost the hospital $190,000 per year. That's for cartridges, devices, and data, the entire system. And with this, we project the hospital would stand to save over $400,000 in savings from preventable infections. Now, you don't need me to tell you how many hospitals there are in the United States. With our average account at $200,000, this is a huge opportunity. And with the healthcare reform coming down the pipeline, focusing on improved quality of care and reduced costs, the pressure has never been greater on the healthcare industry to prevent these infections.
When we came into Healthbox, we had a couple of prototypes, a few people we knew at hospitals, and a lot of excitement on our end. But over the past 3 months, we've taken leaps in the development of our technology. When we came in, all we had was frequency data. We could count the number of times that you use SwipeSense throughout the day. But today, we have location data. We can now set meaningfully benchmark goals for individual healthcare workers. And not only we can do more with our technology, we've actually halved the cost of our devices. We started off with over $50 per device, now we're well under $20, and we're projected to even go lower than that. And in the meanwhile, we've been working with some of the top IP lawyers in the city, so we're extremely covered in intellectual property front as well. So coming into Healthbox, if you had asked us how much money we would be raising today, we would probably tell you somewhere around the ballpark of $500,000. But we've gathered such a huge amount of interest from our partners and beta customers, we've decided to take on more capital and take a bolder step towards solving this problem. Today, we're raising $1 million. With this funding, we'll be adding a third engineer to our team who will be solely focusing on our web application. We'll be allocating more funds towards product development around the physical device and extending funds towards manufacturing and tooling, which will get us ready for production. This will give us an 18-month runway. And the big milestones that we are going to hit in this timeline is executing the 5 pilots that we already have set up and converting at least 3 of them into fully implemented SwipeSense systems. So let me show you what our immediate timeline looks like. Today is April 4th. We're at this awesome event and we're really excited to be here. In May, our trial with Northwestern Memorial is going to begin and we'll have the results by July with a published scientific paper. By August, we'll have our Gen 1 device market ready, and in September, we'll begin the rest of our trial period with our partner institutions, and by December, we will convert the first one into a fully paying customer. Before we get off the stage, we just want to acknowledge some of the incredible help that we've been getting over the past few months. First of all, thank you, Healthbox. You guys made this entire thing possible. You guys are awesome. Thank you, Northwestern and Design for America, for believing in us from day one. That means a lot to us. And thank you to each and every one of our mentors and advisors. You've not only helped us grow our company, SwipeSense, but you've helped us, Mert and Yuri, grow as individuals as well. So together, we can create a world where there is no such thing as a preventable hospital-acquired infection, and we can save those 100,000 lives. Thank you very much for listening to us. We're called SwipeSense, and we're looking forward to meeting every one of you.